Hey friends, for those of you who are new here, I'm Dr. Meggs, and this is Everyday Vet, where we bridge the communication gap between medical professionals and pet owners. Today we're going to talk about how to prevent heartworm disease, an invisible yet potentially very serious medical condition in dogs. Heartworm disease can be very tricky because some dogs can live for years without ever showing any clinical signs of infection. It takes about 4 months for the worm to migrate to the vessels above the heart, and once they get there, they can start causing irreversible damage pretty much immediately, and unfortunately for some dogs, if left untreated, this can actually progress to fatal infection. So good news though is there are things that we can do to prevent it, and if your dog does get infected, there are things that we can do to treat it. So there's definitely things that we can do in order to keep your dog healthy. So first off, I'm going to dive into some of the basics about heartworm disease and what you really need to know about it and how to prevent or treat it even. And then if that's all that you take from this video, that's fine. That's really the key points. But if you do want to go more deeper into the medical discussion, I will be diving into some of those more nitty-gritty details. And don't forget, you can always skip through to chapters as outlined over here. That way you can really pinpoint the section that you're most interested in. Okay, so let's dive in. It all starts with the mosquito that's infected with a heartworm larva. When the mosquito bites the dog, it injects the larva into the dog's bloodstream. The larva then starts to mature into the adult, where it eventually makes its way up into the heart and the lungs. Now, having the worm sit in the vessels around the heart and the lungs can cause a lot of damage in the area, including inflammation, clot formation, and even obstruction of blood flow. So, worst case scenario, there's a lot of worms sitting in there, the flow of blood is obstructed into the heart, and your dog will have to have emergency surgery to actually remove the worms from around its heart. Best case scenario, and unfortunately it's still not that great of an option, if the dog has adult heartworms but not enough to need surgery, we can still treat them, but the treatment to kill the adult worms is actually an injection of an arsenic-based compound. And I'm sure many of you know arsenic is a poison. So we're literally intentionally giving your dog a pretty hefty poison in order to kill those worms. So what we really want to focus on is preventing those larvae from ever getting to the point where they're the adult worms and causing the issue. So if we look at the overall prevalence of mosquitoes and heartworm disease in the country, we can see there's certain areas that have higher prevalence, but unfortunately you can't really get away from the risk entirely of your dog getting exposed to heartworm disease. So we can't prevent the mosquito from actually biting the dog and passing on the larva. What we need to focus on instead is preventing the larva from turning into the adult worm. And fortunately, we actually have a lot of options for doing that. We have chewable medications, we have topicals, and we even have an injectable that you can use that kills the larval heartworms such that you can't ever have the development of the adult worm. Now, when we're dealing with chewables, one of my go-tos is going to be Interceptor Plus. It's a flavored chewable. Because it's chewable, it's really nice. It doesn't have any mess. Most dogs really like it, and they even think that they're getting a treat. So it's really easy to administer. The other nice thing about it is it has intestinal parasite coverage too. So while you're killing off those adult heartworms, you're also killing off worms in the intestinal tract like roundworms, whipworms, hookworms, even tapeworms. So you get a lot of benefits just from the one preventative. The other nice thing about it is you can get an entire year's supply of Interceptor Plus for less than $100, so it's also pretty cost effective. Now, some downsides of it is going to be based on it being a chewable. Not every dog likes to eat treats and chews, so if your dog doesn't eat it, it's not going to work. The other thing to consider too, because it is flavored, there is potential for that flavor to actually interfere with diet trials. Some dogs have food allergies and we have to put them on special diets in order to get their allergies to clear up. And if your dog has a food allergy to the flavoring used in the flavored heartworm chew, not going to be your best option. But that's where our topicals really come in and are nice to use. Advantage Multi is a common one there. It's nice because you just put it on the back of your dog, and it's absorbed into the skin that way. You don't have to worry about the dog eating it. You don't have to worry about any interfering with like diet trials, for example. The nice thing about Advantage Multi is it also covers some intestinal parasites. It even covers a mite that can cause skin infections, and it also has flea coverage in it too. So you get a lot of broad spectrum coverage from that one as well. Downside, of course, though, is going to be that it is a topical, so it does have potential to cause mess. Maybe if you have small kids in the house, you might not want to use a topical because you really don't want them touching that chemical. But again, it's a good alternative if your dog isn't going to eat that chewable. But things to consider with both the chewable and the topical is they have to be given monthly. Once that heartworm larva progresses to the adult stage, neither of these categories of products are going to be effective at killing that now adult worm. So if you miss a dose even, you could be, it could be game over. You could have a larva that ends up progressing into the adult stage. So it's very dependent on being given consistently. But that's where our injectables come in and can be a really nice option for people that have that busier schedule and don't want to be having to give a medication every single month. ProHeart is going to be that injection. It comes in a 6-month version as well as a 12-month. It's really nice because it takes away the having to remember to give something monthly. What you do is you bring your dog to the veterinarian, and the veterinarian gives that injection, and it stays in their system for either that 6 or the 12 months, having continuous killing off of those larval stages of the heartworm. Now, the downside is it's only labeled for use of preventing heartworm. When you give it, it's thought that, yes, it can kill off some hookworms, but you're not going to get that broader spectrum of intestinal parasite coverage. But again, if you don't have to worry about giving a monthly preventative and you know that you're at least preventing heartworm disease, it can really be very nice and user-friendly. So the big point is that there's a lot of options of what you can do for heartworm prevention in your dog, and it's really dependent on your own lifestyle as well as your individual dog's needs. All of these products are actually going to be prescription required, so regardless, you'll need to have a discussion with your veterinarian in order to get the product. But by having that discussion, you can also talk with them about what's going to be the best option, because I've by no means given an exhaustive list. There's so many options out there. There might even be regional differences too on what's going to be most effective. So it's really important that you have that conversation with your veterinarian, and they can help you find what's really best for you and your pet. So we've now hit on the major take-home points of heartworm disease, and if you want to head out from this point, feel free to do so. Otherwise, if you want to stick around, we're going to talk about the more advanced discussion on heartworm disease in dogs. So first off, heartworm is actually called Dirofilaria Immitis, and it has a very complex maturation and infection cycle. So what happens is it actually requires 2 dogs and a mosquito. Dog A is a dog that has heartworm disease. So this dog has adult heartworms that are living around its heart and its lungs, and they're reproducing. And their offspring is known as microfilaria. Those are those really young, immature worms. And those microfilaria are going to be circulating through dog's A blood supply. When the mosquito then comes and bites dog A, it's going to be sucking up that blood, but it's also going to get those microfilaria. The microfilaria then mature into the L3 larval stage in the mosquito. So a section of the Dirofilaria Immitis' life cycle is actually occurring within the mosquito. It's maturing to a new stage of development. It started as microfilaria, and it's now turning into a larval stage. And that L3 larval stage is the stage that is infective to other dogs. So when that mosquito then goes and bites dog B, it's passing along the L3 larva into dog B. The larvae then start to mature and go through circulation, turning into the adult worm like we already discussed. But what's interesting about it is it has to undergo that stage of development in the mosquito. So the mosquitoes are definitely a really critical part of the overall life cycle of Dirofilaria Immitis. Now, once that larva has entered dog B, it starts to migrate through the tissues. So at first it's going to stay in those more peripheral tissues, and it's going to become an immature worm, eventually an adult, and then lastly it'll turn into that mature adult that is going to live outside of the heart and the lungs, and that one's then going to start also reproducing new worms, and then eventually dog B will also have circulating microfilaria. But that whole process of getting infected with the L3 stage all the way to the circulating microfilaria can take as much as 5 to 7 months. So it's not a quick thing. And one of the complex things about heartworm disease in general is how we identify it. So when we're doing tests on dogs to determine if they have heartworm disease, we're taking a blood sample. So we have to be able to find something in that blood sample. Now, one might think, oh, maybe it's the larval stages or even those microfilaria. But the interesting thing is that the blood sample that we take from dogs is actually an antigen test. So we're checking for antigens that are produced by the female heartworm living in your dog. So in order for it to be kind of exacerbating this infection, there has to be that female there to reproduce, but to also create that antigen. So if we're testing before the 5-6 month mark, your dog will not have developed the worm into the mature adult female worm, and your dog can actually come up negative on a heartworm test even if it actually has infection. So that's why it's so important that we continue to do these yearly heartworm tests, because, for example, if you do a heartworm test in July and you accidentally missed the dose in May, yes, you could be having the dose of the preventatives. If you miss the preventative dose in May, you could have some larval stages that ended up progressing to the adults and aren't killed off by the heartworm prevention, but you might not have yet developed the full mature adult and you won't pick it up on the heartworm test. So yes, you need to continue with regular prevention, but you also need to continue with regular heartworm tests, because if you don't, you might miss some of the infection that has gotten through. Now, the adult worms can actually live for quite a while in your dog too. They've been known to live for as long as 5 to 7 years. And the adult females can actually even get to be a foot long. So if left untreated, even if it's just for a short period of time, those worms can actually do a lot of significant damage in the heart and lungs of your dog. Now, I mentioned a little bit before too, their potential to obstruct blood flow. What can happen is if those really long worms are sitting right in the vessels above the heart, it can cause what's called caval syndrome, and that's where essentially the blood flow into the heart is completely obstructed, which of course can be a fatal condition. So now let's discuss what we're going to do if the dog tests positive for heartworm disease. So what this means typically is going to be an antigen test. So most of our heartworm tests are checking for that antigen, which is a protein that is released by the female heartworm. So if the test comes back positive, it means that there's likely a female heartworm that's an adult living in the dog. But no test is perfect. So before we start doing this difficult treatment, because remember, again, it's an arsenic compound, the treatment's expensive and it's hard on the dog. So before we actually proceed with the treatment, we want to make sure that we truly have an infection. So we're going to need to confirm that diagnosis. The first thing that we're going to check for is going to be microfilaria. So remember when we talked about the life cycle, when your dog originally got infected, it was with that stage of larva called the L3 larva. If the microfilaria are the babies produced by the adult, so the infection started with that L3, and then we moved to the immature adults, the adults, and the mature adults. The only way to get that earlier stage of worm, the microfilaria, is if there's actual adults actively reproducing. So if we do a blood test and we're able to see the little baby heartworms basically in there, we know that there has to be adults, and the positive antigen test is then considered to be confirmed, and we proceed with treatment. Now, what do we do if we don't see microfilaria? So remember that antigen test was to check for the protein that's released by the female heartworm. If there's only a female heartworm and no male heartworms present, they're not going to be reproducing. There's still that adult heartworm infection present, but there's going to be no actual microfilaria. So the microfilaria doesn't necessarily rule out the infection. Other things that could cause a negative microfilaria test after a positive antigen test would be if the dog's getting any preventatives that are killing off the microfilaria. Also, if the dog's it's early on in the infection and the worms haven't reproduced very much, maybe there's just not very many microfilaria circulating yet. So a negative test of microfilaria is used not so much to rule out infection. Rather, if we see microfilaria, we say, yes, the positive antigen test is accurate, there is an infection. But if the microfilaria test comes back negative, we can't rule out the infection, so we still have to do another test in order to confirm. So what do we do at that point? Well, at that point, we run another antigen test. We don't run the same antigen test that we ran the other time. We run one from a different lab, a different company, whatever. It's basically we want to have 2 different labs saying, hey, antigen positive on 2 different tests, and then we consider that positive for heartworm disease. So moving forward then, we first need to focus on stabilizing the dog and reducing any side effects that are going to occur from treating for that heartworm infection. Remember, it's very hard on the body, so we want to set up the dog for success before we just jump in with that injection that's going to kill the adult worms. So first thing that we typically do is we start them on a steroid. That steroid's going to reduce the inflammation that'll occur in the lungs as we're killing off those heartworms. And it's just going to overall help with that inflammatory response. The other thing that we do sometimes, and this one's going to sound really weird, is we'll start them on doxycycline. Doxycycline is an antibiotic. And it's kind of a weird concept because Dirofilaria immitis is a worm. It's not a bacteria. You're not going to kill a worm with an antibiotic. That just doesn't make sense. So what's going on here? Well, it was actually found that there's a bacteria called Wolbachia that's associated with Dirofilaria immitis. So when we give doxycycline, we're actually targeting that Wolbachia bacteria, and it's been hypothesized that if we kill the Wolbachia bacteria, we're actually weakening that Dirofilaria immitis worm. So we're essentially, by doing the doxycycline and the prednisone, the steroid, we're reducing that inflammatory response, and we're also weakening the worms before we actually go all in with the adult killing medication. So we're trying to set the worms up to be more susceptible to being killed, so that way we have to do less extreme measures to get there. So our next step then is going to be to continue with heartworm prevention, because we want to make sure we're not getting any more larval stages progressing. And then we're going to be doing that steroid, we're going to be doing that antibiotic, and then eventually we're going to give an injection of melarsamine, which is that compound that we talked about before that's going to be like an arsenic compound that's going to kill the adult worm. So when we give that injection, we give it very deep into the muscle of the dog. It's really important that it goes in the muscle because that's how it's been found to be effective. And we're going to give that injection, and we're going to keep the dog in the hospital to monitor, because what's going to happen next is the adult worms are going to start to die off. And when the adult worms die, especially like in the lungs, you're going to get an inflammatory response there. You actually get what's called thromboembolisms, which are little clots even forming in the lungs as the worms die off. So the more worms that are present, the more severe the signs are going to be as we're killing them off. So it's really important that the dog is staying with the veterinarian during this time frame, so that way we can monitor and do whatever we can to keep the treatment minimal on the dog. So we give that first injection, and we're going to have to do extreme exercise restriction. So there's going to be worms dying off in your dog. You don't want to put your dog's heart or lungs under any added stress of exercise. You've got to keep everything calm because there's a lot going on right now. So they have to be strict cage rest, as in they're going to need to be confined to a very small room, preferably a crate even, and the only time they're out of their crate is when they're on a leash to go outside to go to the bathroom. You can't just let these dogs run out into their backyard, because if they're running, they're exerting themselves, they can really exacerbate the damage on their heart and their lungs. So unfortunately, they need that super strict exercise restriction, which in my experience at least is one of the hardest parts of this process, is trying to keep that dog calm for an extended period of time. So we've given that first injection now of what we call adulticide, so melarsamine, it's that arsenic compound. We've given that injection. Now we wait a month, and a month later we then follow it by another injection. And then we wait an additional 24 hours and we give a third injection. So by doing that, it's been found that there's a much higher success rate of actually killing off the adult worms. If we're putting your dog through getting an injection of an arsenic-based compound, we want to make sure that we're giving enough that we're actually effectively killing off the worms. So at that point, we're going to have to continue with strict exercise restriction in order to avoid any issues from occurring. And then we're going to go out a little bit further from there. So to give you guys a kind of a timeline, we've started, so the first injection of that melarsamine compound was essentially on day 60. So 2 months after that initial diagnosis of heartworm. So we've got day 0, we're going to start like our antibiotics, our anti-inflammatories. Day 60, we give that injection of the melarsamine. Day 90, so 30 days later, we give that second injection of melarsamine. Day 91, we give that third injection of melarsamine. Now we jump out to day 120. And at that point, we're going to check for circulating microfilaria and make sure that there's no heartworms that are still reproducing. And at that point, if they are positive, we're going to need to give them a medication that will kill the microfilaria. We're also going to continue to keep them on prevention throughout all of this. And then we're going to go till day 365, so essentially a year from their diagnosis, and we're going to recheck them on a heartworm test. We don't just jump right in for the heartworm test because, remember, it takes time for things to build up. We don't want to get a false residual positive. But essentially, we check them at day 365, and if they're negative, great, we've considered the infection to be cleared up. If they're positive, then we have to continue with our melarsomin injections. So it's a very long time span. It's not just, oh, the heartworm test came up positive, bring the dog in, give it the injection. No, like we're talking a year, a full year timeline of like when we're timing these injections and when we're rechecking to see if we've effectively cleared the infection. So it's pretty involved. There's a lot of exercise restriction that occurs too. But basically we follow this protocol because it's been established by the American Heartworm Society to be the protocol that's most effective, but also take into account some of the side effects of treatment and try to minimize the impact on your pet in order to give it the best chance of making it through this treatment. Heartworm disease is scary and it's difficult, and my whole point of giving you guys this information is so that way I can really share what I know about heartworm disease, so that way we can avoid getting to the point where we're needing to treat your dog. But if we want to look at numbers, there was a study that was released by Elizabeth Maxwell et al. Back in 2014 through the Journal of Parasitology. They followed 50 cases of dogs with heartworm disease, and these dogs were treated with the 3-injection protocol that's recommended by the American Heartworm Society. And out of these dogs, 50% of them had some mild side effects like injection site swelling, behavioral changes like depression and lethargy after treatment. Another 50% did have some more serious side effects such as heart failure or respiratory changes like coughing. And then 14% did unfortunately pass away before finishing out the treatment. So there are side effects associated with it, and there is mortality, but 86% of the dogs did survive through treatment, so it is a survivable thing. But the key thing is that we want to focus on prevention so that way we don't have to get to the point where we're treating your dog for heartworm disease. As a disease that is highly preventable, we have a lot of room to keep these dogs from getting this disease, and there are a lot of products available that you can work with your veterinarian in order to tailor to you and your dog's specific needs. So really the key is focus on prevention, and then we won't even have to have this more difficult discussion. Prevent the disease, and you're good to go. If you have any questions or comments, please leave them below for me in the comment section. But that's about it for today. I'm Dr. Meggs, and this is Everyday Vet.